Your lungs work tirelessly, taking over 20,000 breaths a day. But what happens when they start to send subtle distress signals that are all too easy to miss? It's a concerning reality for millions. While we often associate lung trouble with a hacking cough or sharp chest pain, some of the most dangerous conditions can develop in silence. These are the unseen threats, the silent lung diseases that creep in without the usual fanfare, slowly compromising your ability to breathe. They don't announce their arrival, they whisper. And learning to hear those whispers could be the key to protecting your health before the damage becomes irreversible. One of the most insidious of these is interstitial lung disease, or ILD. Imagine a man in his 50s, once active, now finding himself winded after simply climbing a flight of stairs. He might dismiss it as just getting older, but it could be the first sign that his lung tissue is slowly scarring and stiffening. ILD is a broad term for a group of disorders that cause progressive scarring or fibrosis of the lungs. This scarring makes the lungs less flexible, restricting their ability to expand and take in oxygen. The early signs are deceptive. A persistent dry cough that you can't seem to shake, a growing feeling of breathlessness during activities that used to be easy, and a pervasive bone-deep fatigue are all red flags. Because these symptoms develop gradually, many people don't seek help until the disease is already advanced. Then there's a condition many think they understand: asthma. But what about its silent counterpart? Picture someone suddenly struggling for air but without the classic high-pitched wheeze we expect from an asthma attack. This is the frightening reality of silent asthma. The airways are still dangerously constricted, but the airflow is so limited that it doesn't produce the characteristic sound. It's a medical emergency hiding in plain sight. Sufferers may experience a tight chest, rapid breathing, and an inability to speak in full sentences. Ignoring these signs because there's no wheezing can be a fatal mistake, as it can quickly escalate to severe respiratory distress. It underscores a critical lesson. The absence of a loud symptom doesn't mean the absence of danger. Another deceptive condition is silent pneumonia, an infection of the lungs that often presents with atypical or mild symptoms, particularly in older adults. Think of an elderly woman who suddenly seems more withdrawn, unusually weak, or mentally foggy. Her family might attribute it to a bad day, but it could be her body's muted response to a serious lung infection. Instead of a high fever and a productive cough, the signs might be a low-grade temperature, general malaise, and uncharacteristic confusion. In the elderly and those with weakened immune systems, the body's inflammatory response is often blunted, masking the severity of the illness. This subtlety makes silent pneumonia particularly dangerous, as a delay in diagnosis and treatment can lead to severe complications. Your body communicates in countless ways, and not all of its warnings are loud. Persistent, unexplained symptoms, no matter how minor they seem, are your body's way of telling you that something is wrong. That nagging fatigue, that slight breathlessness, that dry cough that just won't quit. These are not things to be brushed aside. They are quiet pleas for attention. A visit to the doctor for what might seem like nothing can be the most important step you take. Don't ignore the whispers. Early detection saves lives, giving you and your lungs the chance to breathe easier for years to come.